Hi everyone, I'm Dan Ramey, Litter Media. Thank you again to the folks of the Ross County Health District opening up their doors to us here on East 2nd Street in Chillicothe. We talked with them a couple of weeks ago about the coronavirus and COVID-19, and now we are 2 weeks into this, and we'll start with Ben here. As we sit down and chat today, man, just in the last 7 days, and I know people are going to see this on tape delay as well, so as you're watching this, it certainly changed too. Ben, things have rapidly changed every day, hasn't it?
It really has. It's been a little bit difficult to stay up on the latest guidance, but we have been doing our best, I think. And, it seems to me like things are developing more than changing. So, the advice that's gotten out, I think, is pretty good so far. But you're right. 2 weeks ago, they were canceling the Arnold, right? And at the time, I think a lot of us thought that might be the biggest public, decision that would have to be made in this coronavirus situation. But we've seen now with the school closings, restaurants are only open for carry out, movie theaters, bowling alleys, rec centers. It's just amazing the drastic steps that have been taken to promote social distancing in Ross County. A week ago, we had our first reported case of coronavirus, and now we're up to, I believe it's 67 confirmed cases in the state of Ohio. So you're right, this thing has been taking off quickly.
And we are taping this on March 17th, so happy St. Patrick's Day, but you won't be able to go out to the bar to celebrate. But we are practicing that social distancing as well here. We're approximately 6 feet away. 6 to 10 feet is what you want to stay. Continue to wash your hands. And we'll get into the contact part of this as to why you don't want to have contact with certain individuals. We'll explain all that in just a moment. But earlier today, Adena Health System hosted a town hall which you participated in, along with Dr. Chris Brown and some other representatives from Adena. What did you learn from today's town hall?
Well, that's a good question. I think anytime you get that many doctors in a room, you get to learn specific medical information about the illness. One of the things that they spoke about was the different symptoms that you need to be looking for. I thought that was very interesting. A runny nose or cold might not necessarily be indicative of coronavirus, but Dr. Hayter had said that deep shortness of breath or the lower respiratory symptoms with the fever is really what you need to be looking out for. So I was glad that he was able to clarify some of the symptoms that you don't necessarily need to be as worried about as opposed to the ones that you do.
And these were things that we discussed in our previous discussion as well, but now I think people are a little deeper into all of this, and they're starting to try and weed out what is rumor and what is fact and sticking on track. I should mention who we have with us today, and I apologize. You've been hearing from the administrator of the Ross County Health District, Mr. Ben Avery. We also have Michelle Long, and Michelle is the Director of Public Health Nursing, and joining us today is Kelly Dennis, and Kelly is the Director of Health Promotion as well. This is something you do on a daily basis, talking about how to stay healthy in regards of keeping from spreading germs, right?
Yes, and that's something we always do in public health, is try to inform our population and our citizens on how to be healthy. A lot of our programs focus on that. We kind of are our local experts, so we really encourage our community to listen to what we have to say.
Yeah, and I think that's very key. I know we mentioned on our last segment that if there's a business that has questions, you're here to answer those questions, aren't you?
Yes, we are. Certainly.
Yeah, I think this is a time when everybody's trying to figure out the best way that they can protect their employees and also limit the spread in public. So we're here to walk those conversations through with different businesses and agencies here in Ross County.
Yeah.
And these situations can be different. So that's some of the calls we're fielding now are different types of organizations or businesses that have questions, and they have concerns on how they can keep their employees safe or how to keep from spreading a virus. So like COVID-19. So those are some of the questions that we're fielding right now and working with those community members, and I'm trying to give them the guidance. One thing we are very, very taking very seriously is the social distancing. And in some events, those things are, we have to cancel things. We can't have large gatherings. We are getting to the point we can't even have small gatherings.
Yeah.
So those are some of the things we're currently communicating to the public.
Yeah, just within the last 7 days, we've gone from the last large event I was at was the St. Trace ball game down at Ohio University, and that was already restricted to just a small number of spectators. Church the other day, we had about 45 there, and we don't have a very big crowd at our church anyway, but still, even yesterday, on Monday, the president said, let's limit it to 10. And that's an incredible difference right there.
That's a real incredible difference, but that's what is really, really important. I think that's what a lot of people don't understand about this is going to, when someone is diagnosed, our role here in infectious disease is contact tracing. Therefore, if you're in a large crowd and someone in that crowd who you don't know where they've been has come in contact and contracted it, and they become positive, then everyone that was in that room with them has to be quarantined for 14 days while we wait to see if they get any symptoms. So that's where all of the social distancing is so important, and I think just people have a hard time wrapping their head around that because they seem young, healthy, fine, maybe don't even have a grandma or grandpa they're going home to in the vulnerable population, but it could put them out of work. I mean, there's a lot of stuff to consider when you're out mingling.
We've often heard rabbits multiplying. That's pretty much what this is doing, because one person can spin it onto 4 people at once, then it multiplies into 16 and just keeps growing.
Yep, that's what they term exponential growth. And we are seeing that on a large scale right now. Yesterday, the reportable cases were 50, and now we're up to 67, and it's going to continue to expand that way, I believe.
Yeah, I shudder to think just a few days ago when the governor said, we know these numbers are going to increase. And that's when reality starts to sink in, when you see the numbers begin to increase, and we're trying to limit them as much as we possibly can.
Yeah. The ODH director, Dr. Acton, talked about a dawning. And I think it's all, the reality of the situation is dawning on all of us at a different time period. But many of us now are starting to realize the seriousness of the situation. But the good news is we know what we have to do to limit the spread of this illness. We just have to be disciplined and follow the guidance that we're getting from our governor, from our state health department, from the doctors at Adena. This is very serious, and we want everybody to take it seriously. That's how we're going to limit the spread of this illness.
Do what you're told to do. And that's, like you say, the discipline of making sure you do that. From the town hall today that Adena had, some of the notes I was taking while that was going on, they were talking about being able to screen for patients, which they set up a clinic to do that this past Monday. However, there's a certain criteria you need to meet, so don't hop in the car and drive out just to see if I got it. That's not the case. Michelle, we want to have you talk a little bit about this. Let me go through if you don't mind. Really, the question comes down to who gets tested, and part of this is due to the limitation of the test kits. Essentially, those who require hospitalization, and we'll have Michelle go into this a little further. But the criteria for testing, if you've had close proximity contact with someone who's been infected, if you live with them or maybe carpool with them, if you've had the high-risk travel history, having visited an area impacted, and the symptoms of fever, cough, shortness of breath, and chest pain. Let's go back to the hospitalization part of this, Michelle, because that kind of raises a red flag in some respects.
Yeah. So the screening clinic, you need to meet 2 out of the 3 possible testing criteria. And so if you're in your car and you're driving through a screening or coming to a screening, obviously you're not hospitalized. Therefore, there's one criteria already out the door that you're not going to get tested unless you meet the other 2. And the first one, a fever with severe lower respiratory. So you really need both of those, because even someone with severe lower respiratory without the fever, they may already have asthma or COPD or one of those other illnesses. So you really need that fever to say, we have an infection going on here that's a little bit different. The second thing is that they have been exposed to a confirmed case. And this is ODH guideline. They have to be exposed to a known confirmed case. So it's not just that you were here or there. It actually has to be a confirmed case, and then you can get the testing. If they're hospitalized and they have the symptoms, they don't have to have that known exposure. If there is a reason that they have these respiratory symptoms, they're hospitalized and it's severe and they've tested negative on everything else, then they would do the COVID. I think what we really need to hit home is not everyone needs a test, though. So there are going to be people that have COVID that it's going to be really mild. They're going to go ahead and cruise right on through it. And we're just, they're not really going to know. It's just important that they realize that we have no vaccine for this. We have no specific treatment for this. And they really just need to go home and they need to stay inside for the 14 days, monitor their self, monitor their fevers, monitor, make sure they're staying well. If at some point they reach that severity to where they cannot breathe, things are escalating, they're not getting better, then they need to make that phone call back to the screening center or their primary care and let them know that this is what's been going on. Because we're going to have people that have this that don't get diagnosed. And, it's just important to remember to keep yourself as isolated as possible if you think that it could be.
I think it's important to touch on the death aspect, and the reason for this really is not to really highlight it, but I want to note that while we have a range of 14 to 86-year-old for contracting this virus, only those who have passed have been closer to 80 years old. And I think that's a key element there because of the panic and the concern that a lot of people have. It doesn't mean that if you're 23, you're not going to die, but just the fact that it is the upper range of the ages.
What we're talking about here is our most vulnerable population. That's what this is all about. Mm-hmm. That's why we are using the social distancing, because many younger, healthy people can get this and be fine, but it's those folks that are immunocompromised, have some other pre-existing condition, those are the ones that are most at risk here. And there have been deaths in this country. I think to date, I have notes here that there have been 75 people in the United States that have died from COVID-19 already. And those are, like you said, most likely immunocompromised older adults.
But we want to make sure that a 3-year-old doesn't pass this on to the people they come in contact with.
Yeah, there's a study out of Japan that showed very definitively that young kids were getting this, and they were able to spread it with little to no symptoms. So, there is this it's asymptomatic transmission, they call that. When you're passing it and you don't have symptoms, that can be a dangerous thing in the community. And another reason why we're encouraging social distancing.
And more reason to cover your mouth when you cough, not with your hand, use something else. Your elbow, use the tissues, the whole deal. And again, wash the hands. I was watching The Tonight Show the other night, and Dr. Oz was on there showing the surgical way that they did the Turkish twist, he called it, and then, with the thumbs and the whole deal, during that 20 seconds with soap and water. And I think soap and water is the key right there.
I'm so glad you brought that up, because the last time you were here, we were talking about containment, and that was the number one thing on our mind: wash your hands. Now we're mitigation strategies where we're trying to do social distancing, but we don't want to forget that along with social distancing, cleaning the surfaces, washing the hands, cough etiquette, staying home when you're sick, all of those things are still just as important as they were back when we were in the containment phase. This is just another layer that we've put on it with the social distancing. So.
We still have much more ground to experience. There's no question there. At this point, what else do you want to touch on today in this discussion? Because we hope to have other discussions down the road here.
The science is changing, but we're looking at models. You know, the more data you have in, the more accurate your models get. We're hearing from the state health department, just a few days ago, estimates that Dr. Acton had mentioned possibly, based on models, that there was 100,000 people in Ohio that could have or had the coronavirus illness as of this point. So we know it's out there, likely spreading in the community. Just because our testing abilities haven't been ramped up yet doesn't mean that we shouldn't be concerned and be taking active measures. I think that's one thing that I would mention.
Yeah. And I know a lot of people feel inconvenienced right now, and it's difficult if your business is shut down for a 2-week or 3-week period, and we don't know, this could go on 8 weeks. We're just not sure. But if we can lessen the impact, it will be over sooner than we think, right?
Yes, and I think we lessen the impact by following what Governor DeWine and Dr. Ramey Acton's guidance are telling us to social distance, keep informed, and continue to remove ourselves from those environments where you could become infected.
Going back to the modeling, Dr. Acton had mentioned that some of the smartest people in the country are working on these models at UNC and other universities. Based on the information that she has received from them, this COVID-19 outbreak may peak in Ohio sometime around May 1st. So this is going to be a long haul. We've got to stay diligent, and it's not going to be finished overnight. This is not a sprint. This is a distance run, and we need to know that going into it.
Yes, we often have learned with workout strategies and things, you got to do something 21 straight days before it starts to sink in. So, and I've been the worst at that, but I have been washing my hands and doing all the stuff we're supposed to do. Those are simple, easy things. That's not like getting on a treadmill. So keep that in mind. Michelle, do you have any final words?
Yeah, I think and I've heard it on other calls and things that I've watched, we really just need to hunker down as a community. And if we can do this and social distance, because people act like it's going to be forever, and it's not. We just need to hunker down and do this. And if everyone would just social distance and follow the rules, that it would be so much easier to get through this, and quicker. So
I heard it said earlier, we are a nation that has been built on tough times.
yes.
And while it's been rather soft here for during our lifetimes, we didn't have to go through what our grandparents did. But we're going through something now. So I think we just need to stick together, pray for one another. And if you're a praying individual, if not, become one. What can it hurt, right? So, well, thank you again for your time. And if anyone has any questions, check cdc.gov, check odh.ohio.gov. And Ross County, you've got to...
RossCountyHealth.org. We've got a COVID page. We try to keep that up to date on information. So visit our website or just RossCountyHealth.org.
I'll reiterate what Michelle said earlier. There's no vaccine for this. There's no antivirals. The only thing that we have are those public health strategies that you had mentioned, the washing the hands, the cough etiquette, the social distancing. That's what we have to treat this outbreak. Mm-hmm. And just keep in mind that your actions affect other individuals, potentially individuals that you'll never know or you'll never meet. The other thing is, for businesses and agencies in the community, the best public health advice that we have right now tells us that, we need to limit our operations severely, strictly limit our operations. I know that's not possible for some people that are in the court system or who are providing vital healthcare services. So the second best thing that we can do is try to limit that public interaction in your agency or in your business. Again, as we said at the beginning of this show, the health district's here to help walk you through those tough conversations. We may not find we will try to find the best possible solution for your situation.
It may not always be the answer you're looking for, but along those lines, it may be the best for your situation. And the best thing is, as you mentioned, follow all these tips that they've given to you. That is absolutely free. There's not costing you anything, and govern ourselves, and we can help each other. So thank you again, and we will talk hopefully in a week, and let's see how things pan out here.
I look forward to speaking with you, Dan.
All right. Michelle Long, Ben Avery, and of course, Kelly Dennis. I'm Dan Ramey. Thanks for watching. If you have any other questions, we'll put those links down into the description of our video. Just take a look down there and you'll be able to find all the information to help you find out more about the coronavirus COVID-19.